Hi guys, my name is DR.LEE Sung. Welcome to my YouTube channel. Before you even think about starting testosterone replacement therapy, listen very carefully, because what I am going to tell you today can completely change the way you look at your energy, your performance, your mood, and even your long-term health. Most people think testosterone therapy is just a simple injection, a quick solution, a fast fix for tiredness, low libido, or low motivation. But reality is very different. This is not just a boost. This is a full hormonal system change. And once you understand what is actually happening inside your body, you will never look at TRT the same way again. So let's start from the beginning. Your testosterone is not just a hormone number on a report. It is part of a full communication system in your body. Your brain sends signals, your pituitary gland controls instructions, and your testes respond. This entire system works like a finely balanced network. Now, the moment you introduce external testosterone into your body, this natural communication system starts changing, slowly, silently, and sometimes permanently. Your brain starts thinking, we already have enough testosterone, no need to produce more. And when that signal reduces, your natural production can decrease. That is why TRT is never a simple decision. Now let's talk about something very important. Many people start TRT for the wrong reasons. They feel tired, they feel low energy, they feel less motivated, they think their testosterone is low, but in reality, these symptoms are not specific to testosterone alone. They can come from many hidden causes: poor sleep, chronic stress, anxiety, depression, vitamin deficiencies, thyroid imbalance, poor diet, lack of physical activity, and even lifestyle burnout. So the first mistake people make is this: they treat the symptom as the disease, but symptom is just a signal, not the root cause. Now, before even thinking about TRT, the first step is proper testing, and not just a basic test. You need a complete hormonal profile: total testosterone, free testosterone, SHBG, LH, FSH, estradiol, prolactin. Because if you only check one value, you are only seeing a small piece of a very big puzzle. Now, another important thing: testosterone is not stable throughout the day. It naturally fluctuates. It is usually highest in the morning and lower later in the day. So if you test at the wrong time, you can get a misleading result. That is why proper morning fasting tests are important, and even better, repeat testing on a different day, because one report should never decide lifelong hormone therapy. Now let's go deeper. Your lifestyle is directly connected to your testosterone levels. If your sleep is poor, your testosterone drops. If your stress is high, cortisol increases, testosterone decreases. If your body fat is high, hormonal balance gets disrupted. If your diet is low in nutrients, hormone production slows down. So before TRT, you must honestly evaluate your lifestyle, because in many cases, the problem is not permanent damage. It is reversible imbalance. Now listen carefully to this part. Your body always prefers natural production over external hormones, because natural production keeps the system balanced. External hormones override that system. So TRT is not something your body needs first. It is something your body may need later after proper evaluation. Now let's talk about reversible causes, because this is where many people make a big mistake. Vitamin D deficiency, very common, and strongly linked with low energy and low testosterone symptoms. Thyroid issues can mimic testosterone deficiency almost perfectly. High prolactin can affect libido and mood. Certain medications can suppress natural hormone production. If you miss these, you may treat the wrong problem completely. Now, another important truth: starting TRT is not just about feeling better. It is about changing your long-term hormonal baseline. Once external testosterone enters your system, your natural production may reduce, and in some cases, recovery later can take time, or may require medical supervision. That is why TRT should never be rushed. It is not a shortcut. It is a long-term medical pathway. Now let's be very honest here. TRT can help, yes, in the right person, with proper diagnosis. It can improve energy, mood, libido, and quality of life, but only when it is actually needed, not when it is assumed. Now, before you even make a decision, you need to ask yourself something very honest. Am I dealing with a medical hormonal deficiency, or am I dealing with lifestyle fatigue that looks like hormone issues? Because the answer to that question changes everything. Now, if you are still watching this, that means you are serious about understanding your body. So here is the final message. Do not let frustration make this decision for you. Do not let temporary symptoms push you into a permanent change. Take your time, get proper testing, fix lifestyle factors first, and only then, if truly needed, consider TRT with proper medical guidance. Because once you start, this is not just a short experiment. It becomes a long-term commitment to your hormonal health, and your body deserves that level of seriousness. If you want next step guidance, like how to naturally optimize testosterone, or how to read your blood report correctly, or signs that actually indicate real TRT need, then you can continue with that next level information, because understanding your hormones is not just about treatment. It is about understanding your own body.